Mr. Speaker, I'm pleased to rise in this House and speak about motion M206, brought forward by my colleague, the member for Newmarket, Aurora, and want to thank for this work. The government is on the right track in helping young Canadians become more physically active. However, children are just not active enough, and they are getting less and less active as they get older. According to a report conducted by the Region of Peel's Public Health Department, 32% of students in grades 7 to 12 are overweight or obese. And a staggering 41% of grade 9 students scored in the low fit category of cardiovascular fitness. I would like to take this opportunity to applaud all the wonderful residents of Brampton that teach, coach, and encourage our youth to lead a healthy and active lifestyle. In particular, I would like to thank David Lang and Kevin Montgomery, who lead the BikeBrampton group. According to a report conducted by the region, both the region of Peel and the city of Brampton have partnered with BikeBrampton to deliver cycling encouragement events such as Bike the Creek, which has seen significant participant growth over the past 4 years. I would like to commend the entire team of Union Street YMCA in Brampton, and in particular the General Manager, Ivan Robinson, for his tremendous efforts in helping keep the youth moving. While almost half of the children aged 5 to 11 are active for about half a day, that falls to about a quarter of youth by the time they are 12 to 17 years of age. Children in homes with low incomes are also less active and are at high risk for unhealthy weight. According to the WHO, physical inactivity is the fourth leading cause of death because it is linked to a number of chronic diseases such as heart disease, cancer, and diabetes. People who are physically active live longer, healthier lives. Active people are more productive and more likely to avoid illness and injury. Canadians need to move more and sit less. So what are we doing to address this problem? Earlier this year, federal, provincial, and territorial ministers responsible for support, physical activity, and recreation released a new common vision. Let us get moving to address physical activity and reduce sedentary living. Let's Get Moving was implemented in part by the principles and objectives under the Global Action Plan on Physical Activity, also released this year by the World Health Organization. Let's Get Moving is an important, new, and collective way forward for government to help guide and address physical inactivity and chronic disease prevention in Canada. This week represented an important milestone for government and was the culmination of 3 years of work by officials, including working with federal, provincial, and territorial health officials and non-governmental sector and Indigenous organizations. This vision presents further opportunities to showcase the collective leadership of our government internationally as we support Canadians to move more and sit less. This government is also supporting Canadian youth physical activity through many great programs and research initiatives. Through the Canadian Institute of Health Research, or CIHR, this government is investing in research to better understand linkage between physical activity and health outcomes in youth, including diabetes and cardiovascular health. Over the past 5 years, CIHR has invested over $26 million in research related to physical activity and health, including over $9 million in 2017-18 alone. For instance, CIHR is investing in the work led by Drs. Melanie Henderson and Matthias Frederick and the St. Justin University Hospital Center in Montreal. The doctors there are studying the links between lifestyle choices such as physical activity or sedentary behavior and the development of cardiovascular disease in children with type 1 diabetes. The physical design of spaces and places also plays a major role in helping Canadians move more every day. Why do spaces and places matter? The design of neighborhoods can influence our health. The rise of urban sprawl is a concern, as it has been linked to such things are driving more and eating less nutritious food. The relationship between the built environment, healthy living, people's behavior, and health status is complex. In 2017 report, the Chief Public Health Officer of Canada chose to highlight this topic because of the tremendous potential that changing the built environment has for helping Canadians make the healthy choices. Our government has invested in several projects which focus on making changes to the built environment. In St. Thomas, Ontario, Southwestern Public Health is working to redesign their community so that people can walk rather than drive more easily and more safely. Another great example in the Canadian Cancer Society's Trotis Bus initiative. With this walking school bus, elementary school children have fun walking to school under the supervision of adults who monitor their safety. Canadians will also soon be even more motivated to get moving. Budget 2018 announced $25 million in funding over 5 years for participation to get Canadians moving more and sitting less. Participation has committed to match more federal investment over the course of the 5 years of the Let's Get Moving initiative through a combination of public and private sources for a total investment of $50 million. The organization will partner with municipalities, indigenous communities, schools, sport and recreation organizations, and community groups to involve Canadians in moving more, sitting less, more often. Participation will communicate with Canadians to drive participation in community events across Canada and implement a national multimedia campaign. You might have seen a billboard or heard recently of Participation Better campaign, which encouraged Canadians to get moving because everything gets better when you get active. The campaign shines a light on ways in which everything, such as thinking, mood, and relationship to sleeping, can improve with physical activity. Participation is only one of many partners. No one organization, including government, can work in isolation to tackle the problem of physical inactivity in our country. It is recognized that through active engagement and partnership, we can make progress to support and sustain behavior change that will positively impact health. All segments of society, communities, academia, the charitable and not-for-profit sector, and the private sector must work together. If we are to be successful in getting Canadians to move more and sit less, a great example of federal, provincial, and territorial partnership when in 2010, Minister of Health across the country endorsed the Declaration on Prevention and Promotion, presenting a shared vision for working together and with others to make the promotion of health and the prevention of disease, disability, and injury a priority for action. And the same set of ministers endorsed Curbing Childhood Obesity, a federal, provincial, and territorial framework for action to promote healthy weights, to make curbing childhood obesity a collective priority in Canada. Another example in the partnership is stood to develop and now will make the implement Let's Get Moving on physical activity and sedentary living that I mentioned earlier. The Government of Canada, through its community-based programming, has invested millions of dollars to prevent chronic disease and promote healthy living by partnership with the private sector and not-for-profit sector. Everyone has a role to play, Mr. Speaker. In conclusion, it is clear that our government can be proud of all the work that is doing together with its partner to promote physical activity in children and youth. However, the stats are clear. There is still much more work to be done so that Canadians choose to move more and sit less. We need to ensure that all of the efforts around physical activity across the country are optimally addressing physical activity in Canada's youth. Thank you, Mr. Speaker.